You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, we're talking about gums, bleeding gums, in fact, no more bleeding gums, and loose teeth, hot and cold sensitivity are a thing of the past if you go see your periodontist early enough, and it doesn't have to be painful as well. Now, my third guest of the day is Dr. Merritt, and she is a periodontist, and she's there in Fort Collins, and we're talking about gummy smile. When you smile, you have too much, I guess, gums that are showing, you could do something about it. Or if you have exposed roots, there is aesthetic gum plastic surgery that you can do to really make the gums look beautiful. Well, with us, we have an expert on the topic, Dr. Merritt. I want to thank you for coming on the show.
Hi, Randy. Nice to meet you.
Sure,
Thank you for inviting me.
Now, you a little bit about the topic aesthetic. Is it called a plastic surgery for the gums? I mean, is that the right way to say it?
Periodontal plastic surgery. Okay. There's procedures that entail treating a high lip line, a gummy smile, and there's also procedures to treat patients that have long teeth.
Okay.
You know, as they say, long in the tooth.
What does that mean, long in the tooth, by the way?
It's when people have gum recession, they have their roots exposed. Often they know that because they feel that their teeth are long. They have root sensitivity. They have temperature sensitivity.
So it's more of an illusion of long tooth?
No.
Because the gums are...
Well, their gum has receded to show, they've had gum disease and they've lost some bone. It can have happened during orthodontic treatment, tooth movement. People can lose bone and their gum can start to fall, and so their teeth appear long.
All right. Now, we should mention a little bit about your background. At UCLA, I guess you were a clinical instructor there and a student there for more than 5 years.
I was.
Is that right?
Went to dental school at UCLA, and I stayed there for my residency. And as a resident, you're on the floor, you're teaching the undergraduate students and helping them with their patients in the periodontal clinic. After I finished, I stayed for a few years after that to continue teaching in the clinic.
Okay, two things. Okay, so we're at the top of the show, and we're short on time. So gummy smile?
Gummy smile. And
easy one to take care of? Are a lot of people worried about this, by the way?
A lot of people, I think a lot of people are. You meet people all the time where you might not realize that they feel that a certain way about their mouth, but like, for example, my front office receptionist in Santa Monica, in a practice I was in years ago, she felt that her teeth were short and squatty, and I never realized it. And she's like a model. She's so beautiful, but she had a gummy smile, and I didn't really realize that until she came to talk to me about it. So I treated her. We planned out. She hated her teeth. She thought they were short and
squatty, short and squatty teeth.
Not very aesthetically pleasing, and so she was going to have veneers placed on all of them. But she displayed so much gum when she smiled, so we raised the gum. And after we did that, she loved her teeth, and she decided she wasn't going to have any restorations. She was going to keep her natural teeth, and she just felt prettier. She felt better, happier. She'd fully smile.
Okay, but the main point of today's show, if you don't like your gummy smile, there's something you can do about it.
Yeah, there's something you can do.
Now, receding gums, and quickly because we're out of time.
To treat receding gums,
and why is it a problem, by the way, other than the way it looks?
It's bad to have because patients have pain. They have difficulty brushing when they have recession because the gum's not on an even plane, so that when they're brushing, they're missing the dips in the gum line. So, hygiene's poor, which leads to more bone loss. And the other thing is that when people have their roots exposed, they have a lot of temperature sensitivity.
If your gums are starting to recede,
right,
you could do something about it.
Graft.
And you better do something early, is that right?
Cover their roots. It's better if it's earlier. You get better results.
Okay, great. Well, I want to thank you for coming to the show. Very interesting.
Very nice to meet you.
It's a pleasure.
Thank you, Randy.
All right, you've been watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to watch this interview again online, you can visit our website and just put in Colorado Periodontist, and you'll find it there. For now, I wish you good health.